It's Opayemi, and I'm doing piece number 2 on The Doctor Speaks. Breast cancer is not pink. Wearing lots of pink to emphasize the point. And if you were able to follow me, you may have already seen Pink Ribbons Inc., which was a great opportunity to look at cause marketing. Thank you, Canada, for waking me up to the idea that so much of money that is being raised for breast cancer research is being raised for research that's redundant, is being raised for pharmaceutical companies, is being raised to promote mammography, which is not being used for prevention. 5% of money for research on prevention, my goodness, and it's certainly not being used for environmental issues, research into environmental issues. So knowing that, I'm going to switch to subject number 2, which is I know a lot about the history of breast cancer treatment, and it's stuff that you really need to know and be aware of because of thinking about the kind of culture that has been heroically treating our women's breasts. Once upon a time, at the beginning of conventional medicine, which was in the 1800s, there was a very, very famous surgeon. His name was Halsted. And Dr. Halsted was a hero. He was a hero in the most fantastic and bizarre ways. First of all, he's a very charismatic medical student, and as a surgeon did very brave, courageous, and some would say, oh my God, what is he really doing? Things such as rescuing his sister when she was hemorrhaging to death, and he did one of the first spontaneous blood transfusions of his own blood, and she survived. And then he did some kind of surgery, and she survived that as well. I don't know what he did. Then he did surgery on his mother, who was jaundiced and dying, and at 2 a.m. he cut into her gallbladder and removed the pus and removed stones. Now, this is the dawn of surgery. We don't have ether. We're just doing really, really minimal stuff. Okay, so when things get a little better in the 90s, he is the inventor of the radical mastectomy. And I need to just say to you all, he invented this with really anecdotal information only. There wasn't anything scientific about Dr. Halsted deciding that the best way to treat breast cancer was to take your breast, all of your lymph nodes, the wall, all the way down to the chest wall, all of the muscles down to the wall, and that was going to improve your life after. Over the years, and there were many of them, it turned out that there was no difference between that procedure and just taking the lump with the cancer in it, as far as survival rates of the women. This wasn't really publicized, though, and documented and scientifically decided until the 1970s. And the doctor who was stalwartly trying to do this differently from probably the 1950s on, he was even accused of malpractice. I'll put the names in the notes under there. People were ready to wring him out for doing lumpectomies. They thought that he was harming the women. And when the Canadian doctor finally did the long-term studies that showed no difference in survival rates between women who had had a lump removed and women who had had their entire breast hacked off, it still took doctors years and years to stop doing that procedure. Because this man was one of our heroes. Their heroes? I'm a doctor, but I'm one of those people who is culturally marginal. Their hero was such a hero to him, the inventor of the residency system, the inventor of the radical mastectomy. We couldn't have been wrong all those years. Think about that when you go on to understand the other piece of our history, which is that many of the chemo agents and many of the idea of radiation therapy came out of war and came out of post-World War I treatments. Chemotherapy particularly, some people who had had mustard gas exposure had lower white cell counts. So somebody started treating leukemic patients who have really high white cell counts with mustard gas, and what do you know? They temporarily improved. That's the key. They didn't even get longer lives. So some of this is about really trying to figure out what kind of trade-offs do we really want, and are we able to make our own choices about how much we're willing to pay for longer lives and what the quality of our lives are. Heroic medicine in the hands of men for women has not always been for our own best good.